Hey guys, welcome to week 26 with Psychological Disorders 1. This is a week you guys have been looking forward to. This week and next week is psychological disorders, which we're going to see are going to lay the foundation for what will eventually become psychological treatment. As we go through, make sure you're keeping all of your information in very clear and concise orders, especially when we get to the types of disorders. So let's get to it. Now, the early explanations of mental illnesses are coming from evil spirits. People didn't understand the world around them, so they tried explaining it. And the easiest way was evil spirits, good spirits, bad spirits, all of that. So they believed if you had any type of psychological disorder, it is because there was evil spirits within you. One of the treatments, and one of the earliest treatments, was the drilling of holes into an ill person's head in order to let the ill spirits out. Also, that lets in bacteria, so those people are going to be dead. So not the greatest plan. We're also going to see that philosophers are going to try to justify it. Well, in the Middle Ages, we're going to see that psychological illnesses are going to be lead to the labeling of witches. So we're going to see that that's going to happen throughout history. So it's easy to say that psychological disorders are really not well understood. And the reason why they're not understood is because of their abnormality. Now, when we talk about psychopathology, or the study of psychological disorders, it's the study of abnormal behavior. So what that means is that the behavior that the person is emitting is not of normal traditional behavior and makes us think, oh, that's weird. If you go to the grocery store and you see someone acting kind of strange, you sit there and say, that's so weird, why are they doing that? That is the basis of abnormal behavior. When we talk about psychological disorders, it's any pattern of behavior that causes significant distress, can cause harm to others, or harms the ability to function in daily life. Psychological disorders stops you from interacting with other people and interacting with a normal aspect of daily life. So it stops you from being able to participate in social situations, stops you from being able to maintain relationships, as well as stops you from being able to form daily life functions, bathing, brushing teeth, doing your hair, all those different types of things. Now, when we talk about abnormality, we have to realize it's statistically rare. It's not typical. It's in less than 9% of the population as a whole have psychological disorders. Now, when we talk about abnormality, it means they deviate from social norms, which means in certain situations they don't act normally. Normally means it's going to fall into a specific and predicted pattern of behavior. When someone opens the door for you, it's normal to say thank you. Sadly, it's normal to kind of ignore them. However, to threaten to punch someone in the face for opening a door to you would be considered abnormal. So when we deal with social norms, it's a deviance from those social norms. Looking at abnormality, we're also dealing with subjective discomfort, which that means is the emotional distress or emotional pain coming from what should be normal behaviors, normal actions, or normal situations. So if you going to brush your teeth causes you emotional pain, there's clearly something abnormal about it, which tells us there's something abnormal with the brain. Now, maladaptive is probably one of the most important aspects we talk about the foundation of psychological disorders. Maladaptive is anything that does not allow a person to function within or adapt to the stresses of everyday life demands. So say, for instance, you have your mom wants you to make your bed every day, and that is just so physically overwhelming and overly bearing, you just can't do it. And more than a laziness standpoint, but it's just too much to do, that's maladaptive. That you can't bathe on a regular pattern because you are afraid of water, maladaptive. You can't brush your teeth because you're afraid the aliens will be able to read your brain, maladaptive. So anything that does not allow a person to function normally or adapt to stresses. Now, when we talk about abnormality versus insanity, insanity is a legal term that is used by lawyers and courts. Abnormality is things that are people who do not follow the social norms. You can only be labeled insane via court. and by doctor's orders by the court. No one walks into a doctor's office and says, "Oh my God, you're insane." That's not how it works. The court order asks a doctor to look at your psychological well being, and then the court asks the doctor, "Are you insane or not?" Insanity is used to argue that a mentally ill person should not be held responsible for his or her actions. If you're mentally insane, what that means is you cannot be held accountable for what you say or what you do. Okay, so if you are not ruled insane, you are held 100% accountable for your actions, your thoughts, your behaviors. Insane means you're not held accountable, which means you typically, instead of going to jail, you would go to a psychiatric ward. Now, when we talk about psychological disorders, we look at them in the perspectives. Now, the first week of AP Psych, we looked at perspectives, and these perspectives are going to follow us for psychological disorders 1, psychological disorders 2, and then through treatment. So, if you don't grasp these foundations of the perspectives, you're going to be pretty messed up for this week and then other next 2 weeks. So please make sure that you really take the time to really sit down and process through this information. So the first type of perspective that we look at for psychological disorders is biological model. This model is the focus of explaining behavior as caused by biological changes in the chemical, structural, and genetic systems of the body. What that means is that if a person has schizophrenia, we blame it on a chemical cause in the brain, that there's too many chemicals, not enough chemicals, those types of things. If a person has depression, it's not because they make poor decisions, it's because there's not enough serotonin in the brain. So anytime you hear the word chemical, structural, or genetic, it always has to deal with the biological perspective, and that is where the root. So a doctor who follows a psychiatrist who follows the biological model is always looking for chemical reasons why things are happening, genetic reasons, or structural. Now, another type of model that we use to look at disorders is the psychoanalytic. Now, the psychoanalytic assumes that abnormal behavior stems from repressed conflicts and urges that are fighting to become conscious. So say, for instance, a person goes into their psychologist's office and they have schizophrenia. A psychoanalytic psychologist would see their schizophrenia as presenting from repressed thoughts because that person did not cope with the trauma of being sexually molested, abused, beaten as a child, whatever the scenario is, they have repressed it into their unconscious, and that unconscious has not been dealt with, and it's now presenting itself via schizophrenia. So psychoanalytic theorists believe that depression is based on not dealing with repressed thoughts, that schizophrenia is created because of not dealing with repressed thoughts, that your dissociative identity disorder is created because you did not deal with a memory or a trauma from your past. Now, the next one is behaviorism, or behaviorists see abnormal behavior as learned. So, for instance, you grew up in a house with a mother who has schizophrenia. You are going to develop schizophrenia because you watched your mother's sporadic behavior and now you mimic it. If you grew up in a house with a depressed mother or father, you mimic their behavior patterns and now you are depressed. Okay, now keep in mind, every time we go through one of these viewpoints, we're looking at the justifications for these disorders. Okay, we're looking for explanations of why each one comes. So, just recalling, our biological, it says it's a chemical imbalance in the brain, genetic structure, or a genetic pass down. Psychoanalytic, every disorder is caused by the repression of thoughts. Behaviorists believe it's a learned behavior. So, a schizophrenic kid watched their mother's schizophrenic behavior, and that's why they have schizophrenia. Now, the next one and the final one is your cognitive theorist. Cognitive theorists believe psychological disorders are created because of abnormal behavior as coming from irrational beliefs and illogical thinking patterns. Because these children or young adults formulated all these illogical thinking patterns, that's what then creates your psychological disorders. So depression is created because a person thinks it's better to stay in bed to solve other problems, not go out into the world and try to fix them. Cognitive psychologists believe that schizophrenia is not caused by a chemical issue in the brain, but in fact because they think that makes the most sense. So illogical thinking patterns formulate the foundation of the cognitive theorist. Now, when we talk about culture and psychopathy, we have to deal with cultural relativity. This is the need to consider unique characteristics of the culture in which a behavior takes place. So, for instance, here in the United States, our culture is a lot louder, a lot more friendly, a lot more talkative and chatty. So, if we have a young child coming around talking and chatting and bouncing around from one person to another and carrying conversation, that's not abnormal behavior. However, in cultures in Asia and in the Philippines, that behavior is not normal, and they're not taught to mimic that behavior from their parents. So that behavior would then be an indicator, hey, something is off, something could be wrong here. So cultural relativity is taking into the cultural expectations of behavior into whether or not they have a psychological disorder or not. We also have cultural bound syndromes, which are disorders found in only particular cultures. Some cultures are more likely to develop certain types of disorders than others. Now, the next aspect of psychological disorders is going to be the DSM-4. Now, the DSM-4 stands for the Diagnostic and Statistical Manual, version 4. We're actually in version 5 now. It's a manual of psychological disorders and their symptoms. This is used by psychologists, psychiatrists, and just regular doctors in order to diagnose psychological disorders. Now, the DSM has 5 axes. Now, the first axis looks at your clinical disorders and other conditions that may be a focus of clinical attention. So, any of your mood disorders, your personality disorders, anxiety disorders, any of the big groups of disorders that are going to be found there. Axis 2 is going to deal with a lot of your social disorders, specifically mental retardation and as well as personality disorders. Axis 3 is going to have your general medical conditions. So say, for instance, you don't know what type of disorder a person has, but you can see that they have these types of conditions, these side effects, they have these weird behavioral or genetic conditions. You can research what it is by looking at axis 3, and that'll back you into a diagnosis. So all of these axes allow doctors to identify, to prescribe, as well as to help offer treatment for the patients. It allows a more clear, concise prescription of what is wrong and a diagnosis to help correct. Axis 4 is dealing with the psychosocial and environmental problems. These are dealing with physical surroundings of a person may have an impact on diagnosis, treatment, and outcome. A lot of like environmental chemical, certain areas of the country, there's more chemicals in the atmosphere than in others, which means that can have an effect on psychological disorders and the chemicals being used there, as well as Axis 5, which is the global assessment of functioning. Now, the global assessment of functioning is looking at how adaptive or maladaptive a person is. Depending on their score on Axis 5 will dictate how much money the federal government will give them in order to subsidize their life. So if you are a very maladaptive because of your disorder, the federal government is going to give you more money to help with living costs and all those things. If you have a disorder but you're very adaptive or you don't need a lot of support, then in fact you'll get less money. So Axis 5 is actually very, very important for all of our patients who do have psychological disorders, because it helps dictate the subsidizing of the federal government money. So keep in mind, the DSM-4 actually has 5 axes, and it's used to diagnose, treat, and help patients who are suffering from mental disorders become identified and live a much more adapted lifestyle. Now, when we talk about the DSM-4, we're talking about medical conditions, personality disorders, clinical disorders, psychosocial and environmental problems. We're taking everything into account in order to prescribe the best treatment and diagnose correctly. Now, over 1/5 of all adults over age of 18 will suffer a mental disorder in any given year. Sometimes we grow into them and grow out of them. Sometimes we grow into them and stay with them for the rest of our lives. It just kind of depends. Now, major depression is the most common psychological disorder in the world. However, anxiety is now giving it a run for its money. It's becoming the most prescribed, the fastest prescribed clinical disorder in the country here in the United States. So, what are some of the disorders that the AXI-1 is focusing in on? Anxiety disorders, mood disorders, schizophrenia, psychological disorders due to general medication conditions, adjustment disorders. That's what AXI-1 is looking at. When we look at occurrences of psychological disorders, we're going to see that major depressive disorder is going to take up about 5% of the population, and that's 9.9 million people are affected with it. Bipolar is 2.3 million, or 1.2% of the U.S. population. When we talk about schizophrenia, all types is only 1.1% of the population, or 2.2 million. When we talk about psychological disorders, we typically say that schizophrenia is the most maladaptive and is the most destructive. Other types of disorders, like I said, anxiety earlier is becoming the fastest diagnosed disorder in the country. The most popular one is going to be your social phobia. And that's going to affect about 3.7% of the population and affect a total of 5.3 million. So, when we talk about the DSM-4, the biggest thing that the DSM-4 is doing is allowing us to put a label on certain aspects of a person's personality in order to better understand it. Now, there's pros and cons for labeling the disorders. First of all, if we label someone who has OCD with the title of OCD, it provides a common language for therapists and their patients. They now have something they can figuratively talk about, there is research to provide for, and they can both take a step forward in having more information to talk about. They allow a clear and effective communication as well as help clients receive effective treatment. If we know what the diagnosis is, then we can provide effective treatment. However, there are negatives for labeling a disorder. By labeling someone schizophrenic, that can hurt how a client sees themselves or how a person sees themselves, and it affects how their actions are seen by others. If you know someone's a schizophrenic, because someone told you they are, you're going to see their actions as a lot more sporadic and unpredictable, when in fact, maybe you would have responded the same way or have not thought anything like it if you didn't know they were schizophrenic. What we're going to see is that the more people are labeled, the more fear other people have of those people. So it kind of goes back and forth. Now, the first major type of disorder that we're going to be looking at is anxiety disorders. Now, we're going to be looking at anxiety disorders, somatoform disorders, schizophrenia. We're going to look at a couple other types of disorders. When we talk about anxiety disorders, somatoform disorders, schizophrenia, there is a subsection of disorders within this broad category. You need to keep what type of disorder it is and the different types of disorders that fall underneath that category organized. Do whatever it takes. I'm going to try helping you in class as well as, of course, on here. But the more organized your understanding of this somatoform or dissociative identity disorder falls in this category, panic attacks fall in this category, the more you keep it separate, the better your life will be. So what are anxiety disorders? Anxiety disorders are in which the main symptom is excessive or unrealistic anxiety and fearfulness. If anyone here has ever had anxiety, we've all had anxiety, no matter who you are. It doesn't mean you have an anxiety disorder, but think of the scariest moment of your life that tight chest, the increased heart rate, the sweating, the feeling like your heart's about to beat out of your chest, the lack of control of being able to regulate your emotions, that is true anxiety. That is what happens with people who have anxiety disorders on a regular basis for a prolonged period of 6 months or more. Now, free-floating anxiety is anxiety that is unrelated to anything realistic or a known source. What that means is you could be sitting at dinner, having a great time with your friends and family at the table, and then all of a sudden you have just sheer panic and you think that at that moment you could die because your heart's going to explode. So for no reason, no trigger, nothing, all of a sudden it just kind of comes in. Now, under anxiety disorders, this is where we're going to have the title of phobias. Now, phobias and fear are two separate things. Fears are, for instance, I don't like spiders. I hate spiders. That's a fear. A phobia would be I spend an hour every single night vacuuming every single corner of my house to make sure there's no spiders in my house. The difference between a fear and a fear is a dislike. I don't like spiders. I don't like heights. I don't like roller coasters. I don't particularly like social situations. Okay, that is a fear. A phobia is when it controls your entire life. So if you have a fear of snakes, you look under every single surface every single night for hour, every single night, making sure there is no snakes in your house. If you have a fear of right turns, you go out of your way to plan a route that requires no right turns. That's the difference between a fear and a phobia. Now, one of the fastest growing phobias is social phobia, which is a fear of interacting with others or being in social situations that might lead to a negative evaluation. With the more interconnected our world is becoming with the internet, with the codependence we have, with the larger populations, all these different types of things, people are now becoming more and more socially phobic. With services like Publix delivery and Amazon, we're seeing a lot more people being reclusive or staying home in order to avoid social situations, which is interesting. Now, under your phobias, you have specific phobias. Specific phobias are fear of objects or specific situations or events. You've heard of these your whole life. Arachnophobia is a fear of spiders. Claustrophobia is a fear of being in small enclosed spaces. Agoraphobia is a fear of heights. Agoraphobia is the fear of being in a place that is difficult or impossible to escape. Those are different types of phobias. Agoraphobia is the most popular type of, most popular one that AP loves asking about. And that's what we're going to see you're going to see it on your test this week because it's always on your AP exam. It'll be on your AP exam. For some reason, they love it. I don't know who the author is, but apparently they're agoraphobic. Now, common phobias, spiders, arachnophobia, lightning, all of these different types of ones. You've probably heard of them most of your life. Now, when we talk about anxiety disorders, one of the most common type of anxiety disorders is panic disorders. Now, some of you have had panic attacks, and panic attacks is, this overwhelming just sensation that your heart is going to, everyone has had stress, but a panic attack is when your body kind of just shuts down because it's so overwhelmed and you can't catch your breath. And it's very, very scary because there's no way you are in control of your body. It's just acting, your heartbeat's racing. It feels like your blood is like on a tidal wave. You can just feel it pulsing through your whole body. You're sweating. You can't catch your breath. You have very shallow breaths. It is very, very scary. Now, most people will experience a panic attack some period throughout their lives. Because you've had a panic attack does not mean you have panic disorder. Panic disorder, you have had 6 or more panic attacks within 6 months. That's a lot of panic attacks. Now, what is a panic attack? I was just kind of describing it, but it's a sudden onset of intense panic in which multiple physical symptoms of stress occur, often with the feelings that one is dying. It is absolutely traumatizing. difficulty with panic attacks is people who suffer from panic attacks fear panic attacks, which only increases the amount of panic attacks. And people who have panic attacks know that worrying about having a panic attack makes panic attacks more prevalent. However, they're so scary and they feel so out of control over their own body that it only continues to trigger more and more panic attacks. Another major anxiety disorder is obsessive compulsive disorder. If you've ever watched True Life on MTV, pretty much every episode is a True Life, I'm obsessive compulsive. When we deal with obsessive compulsive, it's a disorder in which intruding, reoccurring thoughts or obsessions create anxiety that is relieved by performing a repetitive, ritualistic behavior or compulsion. Now, when we deal with obsessive compulsive, it's broken down into two aspects. Obsessive is what you fear. For instance, if you fear leaving on the gas of your stove, so you're afraid you're going to blow up the house or suffocate in the middle of the night because of all the gas in your apartment, that is your obsession, is your fear. Your compulsion would be to check the gas every time you go into the kitchen to make sure it's totally fine and turn the knob a couple times to make sure it's off, to be testing the gas to make sure there's none coming out, those different types of things. So the obsession is the fear. The compulsion is what you do in order to not feel stressed about your fear. Some people have to eat their food in a particular order, that they have a fear of unknowing stress, so their compulsion is to eat their food in a particular order. When we talk about these obsessive compulsive disorder, every single one of you has one thing that you're obsessive about, that you like having a certain way and you like doing it a certain way. Obsessive compulsive means it controls your entire life. It's not just about one thing you like doing or not doing. It's about controlling your entire life. It's just like having a fear. Everyone has fears of something, but if it doesn't dictate your life, it's not a phobia. Same thing with obsessive compulsive. Now, when we talk about anxiety disorders, one of the big things is panic disorder with agoraphobia. A lot of your anxiety disorders actually overlap. If you have obsessive compulsive disorder, you probably have panic disorder. That is one of the unique things about anxiety disorders. If you have schizophrenia, you don't typically have catatonic schizophrenia and dissociative schizophrenia. You typically have one and that's it. But with anxiety disorders, you typically have a blending. Now, one of the most popular makes it sound like people choose it. One of the most common types of anxiety disorders is called generalized anxiety disorder. And it's a disorder in which a person has feelings of dread or impending doom, along with physical symptoms of stress, which last 6 months or more. What that means is think about your absolute worst day and that tight chest feeling, your heart beating out of your chest, that sweating feeling, and that physical response you have to a really terrible, terrible day. Think about having that stress for 6 months or more. Terrible, right? That is generalized anxiety disorder. That it just comes over and takes over your life and you just stress about every single detail and you stress about stressing about every single detail and it just snowballs into this tremendous weight and pressure. In class, I showed you a video about a young lady who is suffering from generalized anxiety disorder, and she talks about what it feels like every single day just waking up. The moment she wakes up is the moment she just feels that pressure in her chest, and she can't catch her breath. She sweats all the time because her body is just physically trying to respond to it. Now, when we talk about the causes of these anxiety disorders, psychoanalytic psychiatrists believe that there are repressed urges and desires that are trying to come into consciousness and creating anxiety that is controlled by the abnormal behavior. So a psychoanalytic psychologist is going to say, well, if you weren't repressing your thoughts and desires, then you wouldn't have anxiety because you're not fulfilling your thoughts and your desires of the unconscious. That is creating tension, which is creating your anxiety disorder. A behaviorist would say that your anxiety disorders are learned through both positive and negative reinforcement. So say, for instance, you were acting really nervous when you were a little kid and someone says, "Ah, that's so cute. You're so so nervous. And then you learn that that was a good behavior in order to get attention. Or you did something wrong and someone yelled at you, your parents yelled at you, and that created this fear of doing things wrong. So you live your whole day stressing out about whether you're going to do it wrong or not, and that creates an anxiety disorder. So psychoanalytic is all about your repressed urges, so you're not listening to, which creates internal tension. Your behaviorists believe that you learned both through positive and negative experiences that this is the way to behave. Cognitive psychologists believe that excessive anxiety comes from illogical or irrational thought processes. So, for instance, your anxiety comes from magnification. You're just making a bigger deal out of things than they need to be. Like that math test you have on Wednesday, yeah, it's a big deal, but it's not end all be all. If you fail it, you're not gonna, you know, die or anything. All or nothing thinking is when people put things into extreme. You're either going to get into the college of your dream or you're not going to get into anywhere and you're going to be a complete and total failure. Those putting things in such extremes make it very, very hard. Overgeneralization. Everyone knows how to do algebra. Everyone knows how to do geometry. Everyone gets this better than I do. Those types of things make it much more challenging. And of course, minimization, or the tendency to give little or no importance to one's successes or positive events. The belief that, frankly, nothing you do matters. Nothing will come out in the end is going to be a cause for cognitive psychologists. And finally, your biological perspective believes that anxiety disorders include chemical imbalances in the nervous system, particular of serotonin and GABA in your neurotransmitters. So they believe that anxiety disorders is overactive or underactive serotonin or overactive or underactive GABA. So there you go. All right, our next disorders is your somatoform disorders. Now, somatoform disorders are some of my favorite disorders because people really hate them. Now, what are somatoform disorders? They are disorders that take the form of a bodily illness and symptoms, but for which there are no physical disorders. Okay? These are people who think they have something physically wrong with them, but there's actually nothing wrong with them. Physically. It's all intellectual, psychologically in their brain. I love teaching this stuff because people get so mad about this. And the people who live with somatoform disorder really do live in pain, really do live in physical pain, but the physical pain is created in their brain and not in the physical extremities of their body. Imagine that. You feel pain, but there's no pain being created from anywhere else but in your brain. Could you imagine? Because if I smacked you across the face, you'd be like, oh my God, you smacked me in the face because I felt it. Imagine feeling something in your hand that actually isn't happening. It's just happening in your brain. Think of how trying and how overwhelming that would be. Now, one of your somatoform disorders is psychosomatic disorder. Psychosomatic disorder is a disorder in which the psychological stresses causes a real physical disorder or illness. What that means is your psychological stress, your intellectual stress, causes a physical illness or disorder. Because of your brain creates physical pain in your arm, in your leg, wherever you want it. Okay? Your brain creates a physical stress, causes real physical pain. So say, for instance, some people have actually physically cut off blood circulation, with their brain in somatoform and psychosomatic have actually cut off circulation to their hands. They get less blood fluid, and eventually that causes a lot of tissue damage to hands and legs because of psychosomatic disorders. In their head, they are not getting enough blood to their tissue, and they will it into actual fruition, essentially. They kind of create this in their head, like my foot doesn't work anymore. I have a club foot. In their head, they've decided they have a club foot. then because of their willpower mentally, it actually creates a club foot. That is psychosomatic disorder, is people will these physical pain, these real issues physically by their mental stress. Now, psychophysiological disorders. So you have psychosomatic, psycho, brain disorder, or psychophysiological disorder is the modern term for psychosomatic disorder. So today, instead of calling it psychosomatic, we call it psychophysiological. So your mental state creates physical pain in order to make that. Now, your next somatoform disorder is hypochondriasis. Now, hypochondriasis is in which a person is terrified of being sick and worries constantly, going to doctors repeatedly and becoming preoccupied with every single sensation of the body. Okay? We call these people hypochondriacs. That is a form of hypochondriasis. A person who has hypochondriasis is a hypochondriac. These are people who believe that they're absolutely dying, that they have, we've all looked on MedMD or whatever, on WebMD, and we've all been self-diagnosed ourselves with cancer, but that doesn't consume our lives. We're like, oh my God, I have cancer, I'm going to die. That doesn't consume our lives. People who have hypochondriasis really truly believe that they have all of these different types of disorders, whether are diseases that are common to absolutely rare or uncommon, and they truly believe that they have them. And they become obsessed with that and will go to one doctor or a next doctor and repetitively trying to get the diagnosis that they think they truly have because they truly believe they have these types of disorders. Now, the next one is your somatoization disorder. The somatoform disorder is in which the person dramatically complains of a specific symptom such as nausea, difficulty swallowing, or pain for which there is no physical cause. For instance, a person who starts vomiting for no reason. There's no physical reason. Person who literally is choking themselves to death, not with their hands, but their esophagus just closes for no reason. They just literally stop themselves from breathing. That is somatoization disorder. They're psychologically controlling their body into doing things the body doesn't typically do. Mind over matter, have you ever heard that expression? That's exactly what somatoform disorders are all about. Now, I think, is the most interesting of the somatoform disorders is the conversion disorder. Now, the conversion disorder is a somatoform disorder in which the person experiences a specific symptom in the somatic nervous system's functioning, such as paralysis, numbness, or blindness, for which there is no physical cause. So conversion disorder is when there is an actual physical, tangible, your doctor knows there's something wrong, like blindness, for no reason. You can literally will yourself blind if you have the conversion disorder. You can literally give yourself paralysis, not be able to walk anymore with the conversion disorder. Now, when you have hypochondriasis, there's no physical elements. With somatoization disorder, there's some physical causes, physical side effects of issues, but no physical outcome of like a disorder or any like blanket statement. Conversion disorders, there is paralysis, there is numbness, there is blindness that has no reason. Now, when we deal with conversion disorder, one of the biggest things about it is it's the most severe of your somatoform disorders, and there is a physical change in the physiological state. Okay? Now, causes of your somatoform disorders, psychoanalytic are going to believe that the anxiety is turned into a physical form. So because you have not dealt with your repressed thoughts, it has now created a physical symptom of blindness, numbness, whatever type of somatoform disorder it is, in order to deal with it or force you to deal with it. Behavioral believe that the negative reinforcement experienced when the ill person escapes unpleasant situations such as combat. So when people find out that you're sick, people are kinder to you, are nicer to you, so you go out of your way to be sick in order to continue to receive that positive feedback of people saying, "Oh, how are you? What can I do for you? Can I take care of you?" Those types of things. Your cognitive is going to believe that your somatoform disorders are caused by people magnify their physical symptoms and normal bodily changes into ailments out of irrational fear. All right, guys. A ton of information, a lot of information. The great thing is in class this week, I have a ton of videos showing you the differences between every single one. Some people from my videos are very, very memorable. Keep in mind, if you watch the groupings of YouTube videos from this, I'll have a couple posted. I'll have a bunch posted in order to support the information from this week. Anyway, guys, good luck and keep up the hard work. Have a great week.